My name is Linda Burchett. I live in Richmond, Virginia. I am 75 years old and I am a 10-year survivor of pancreatic cancer. I thought I was having indigestion and the pain had started radiating through to my back. I asked my husband to Google heart attacks in women because I thought maybe that was what was happening. He immediately took me to the emergency room. They diagnosed me with pancreatitis. Our daughter has had recurrent pancreatitis, so I knew the drill. They did an endoscopic ultrasound. The doctor said, I don't really expect to see anything. And I thought, I don't expect to see anything either. But within 24 hours, he told me that it was pancreatic cancer. I really do not have a high anxiety level. I have a very calm and peaceful inside. So I just thought I was going to have surgery, it was going to be removed, and life would go on. Well, that changed. About 4 or 5 days before the surgery, the surgeon said, your mesenteric artery is 80% compromised, so the surgery is not possible. Where do you want to have your chemotherapy? And I did not handle the chemotherapy well at all. I was sick all the time. But the big milestone that kept me very, very motivated was when I was diagnosed. About a month later was when I found out that we were going to have a grandchild. So I was very motivated to spend my life with him. The tumor shrunk enough to proceed with the Whipple surgery, but with a vascular surgeon there with me. After the Whipple surgery, it was supposed to be 4 weeks of everyday radiation and everyday chemotherapy. And everything went wrong. An infected port, the blood pressure going too low, temperatures going too high, and white counts being too low. It really took me down. And instead of it lasting for 4 weeks, it lasted for about 3 months. And I've always been a Christian, but it is amazing how close to God that I became. And that's what really got me through. I had my first clear scan on October the 15th, and our grandson was born on October the 16th. So it was the best week of my life to be clear of pancreatic cancer and to have a first grandchild. After I was healed, I would come back to the infusion center and I would be an encourager to the people that were there. So I had to have everything go wrong so that I could relate to everything that they were going through, because no one had anything that I had not been through. And now, 10 years later, that is still what I do. It's been such a gift to be able to provide that encouragement. This is not a journey for you to take by yourself. Read healing books, read about survivors, watch the Let's Win videos. I am so honored to have been asked to participate. I have always been a very positive person. However, having had pancreatic cancer, that has gone 100-fold. Because of being able to bless other people, that's what I really want to accomplish, to make connections with other people going through this journey. And I'm just enjoying and celebrating every day.